and thanks for being here. In the State of the State, as well as the budget address, I talked about 4 areas I'd like the legislature to focus on. And this is in addition to what I've asked them to do over the last few years: housing, education, public safety, and affordability. So we can follow through on the issues voters elected us to fix and build on the progress we've made last year. Last session, we were able to get project-based TIFs over the finish line, as well as a tax exemption for military retirement pay. Both policy changes that I and many others have been working on for years. Those are just 2 examples of the type of initiatives we need to move the needle on the affordability crisis and housing crisis. And I believe this was accomplished due to more political balance in the legislature, so that different perspectives were heard and they were allowed at the table. I also believe this will continue to help move Vermont in the right direction. Today, we're going to focus on health care, which I know gets complicated, and it isn't the easiest understood topic for most of us. We just know that when we're sick or injured, we want it there for us to use. But it's important to talk about it because fixing our health care system is integral to making Vermont more affordable. Today, I'm joined by Secretary Samuelson, Commissioner Sampson, and Chair of the Green Mountain Care Board, Owen Foster, 3 of the key leaders in state government charged with working together to reform our healthcare system. They'll talk more about the work we've done and the work we still need to do to make healthcare work better for Vermonters. Many have felt the effects of rising healthcare costs, which isn't unique to Vermont and is something many other states are experiencing. But even with the cost of healthcare increasing across the nation, Vermont stands out, and not in a good way, with some of the highest insurance premiums and costs of care in the country. And with an aging demographic who rely on the system more often, with fewer young people, costs only go up further. So my team put together a healthcare proposal this session to address the health insurance market in Vermont, to make sure Vermonters have access as well as choices when deciding where to get the care they need in all parts of the state. And it's focused on 3 areas: more insurance options for Vermonters, a more efficient service delivery, and more accountability on the part of insurance companies, which Commissioner Sampson will talk more about in a few minutes. Now, I know change is hard, but it's clear the current system that we have in place just isn't working for far too many. And instead of throwing more money at the problem, we need to address the root causes and fix the system. If we can reduce the cost of health insurance by making sure care is affordable, while also expanding access to other coverage options, I believe we can make progress, which will reduce the cost of living in Vermont and help attract the working class families we desperately need. So with that, I'll turn it over to Secretary Samuelson.
Thank you, Governor. Good afternoon, everyone. I want to build on what we just heard about and focus on what we're doing right now to transform the healthcare system and why it currently matters at this moment. Vermont's healthcare system is in crisis. People can't always get the care they need when they need it. Healthcare is too expensive for families, employers, and the state, and healthcare institutions are in financial crisis themselves. And too often, care is duplicated, uneven in quality, or dependent on where you live. Doing nothing is not an option because the current cost trajectory is not sustainable. We cannot continue to ask Vermonters to pay more for a system that's not doing as well as it should. Our healthcare system was built over a time to meet the needs of the past. It was designed around in-person care, hospital-based delivery, and independent institutions often operating largely on their own. But Vermont has changed. We're older, we're more rural, technology has changed, which allows us to deliver care in different ways, and workforce shortages now affect almost all of the healthcare system. The system we have today is expensive in part because it is built for a Vermont that is very different than the Vermont we have today. If we were designing a healthcare system from scratch with affordability, access, and quality in mind, it would be very different. Affordability doesn't come with one decision or one program. It comes from redesigning how the systems work together. Our approach across healthcare providers, state entities, the legislature, and focuses on 4 affordability principles. First, we need to pay the right amount for care. We need to stop paying different prices for the same services depending on where it's delivered. This includes tools like last year's legislation that put caps on pharmacy costs. Getting care in one setting should not be, determine the costs and be lower in another setting or higher. Second, we're working to increase access while reducing duplication and waste, and this is where the AHS comes in. When services are duplicated unnecessarily or not available and where they are needed, costs go up and sustainability goes down. Some services we need to happen at the local level. Other services should happen at the regional level, and some highly specialized care should happen at the statewide level. Affordability depends on putting care in the right place and not everywhere. Third, providers in the state are focused on making the system work better. Affordability requires efficiency, reducing administrative overhead, and sharing services where it makes sense, and our hospitals are making great progress in this area. We have to make the system work better, not just spend more to hold it together. Fourth, we need to strengthen choices. Affordability improves when people have meaningful choices and when providers and insurers compete based on value and not volume. That means preserving patient choice in where and how they receive services and care, encouraging competition among insurers and insurance plans to offer better value and more options, and making prices and options clear so people can make more informed decisions about where they get their care. When people have real choice and plans compete on value, the system works better for everyone. So what are we doing now to redesign the system? Work is already underway leveraging studies of cost drivers and system performance, including the statewide health systems analysis commissioned by the legislature through Act 167. Based on these studies and resources more recently available through the federal government, like the Rural Health Transformation Funds, for which we have received an annual award this year of $195 million, and potentially over 5 years up to close to $1 billion, we are able to change the way the system is structured. I want to be clear, the funding itself is not reform. It's the tool that lets us put affordability plans into action. Here's what's happening on the ground to put affordability into practice. With technical support and consultation from the Agency of Human Services, hospitals across the state are developing concrete transformation plans focused on affordability, access, and quality. By March, we'll have actionable proposals aimed at taking the first steps in defining essential services, sharing services and infrastructure, reducing duplication and administrative costs, and aligning care that the community needs with affordability as a requirement and not an afterthought. To strengthen primary care, we're using the transformation funding to make investments through the Blueprint for Health by investing in community health teams and primary care practices, strengthening primary care as the front door to our healthcare system, and reducing reliance on higher cost settings. Strong primary care is one of the most effective ways to control cost and improve outcomes. The Rural Health Transformation Funding will also be used to support efforts to strengthen rural health networks. Stronger collaboration and coordination among providers including hospitals, primary care, home health, skilled nursing facilities, mental health and substance use treatment providers, and emergency medical services, along with innovations in the models of care, reduce duplication and improve quality in the care that Vermonters receive. So we're investing in things like better coordination between providers with tools like expanded telehealth and electronic consultations. We're working with to enhance community-based care, such as mobile clinics, community paramedicine, mental health and substance use urgent cares expansion statewide, and enhancing residential treatment in substance use and mental health. We're also looking to invest in recovery housing. We're investing in hospitals, clinics, and other providers to lower overhead by sharing electronic health records, remote monitoring platforms, referral and care coordination tools, and operational services like human resources systems and transcription services. We're also committing to strengthening our healthcare workforce through opportunities like tuition assistance and on-site clinical training. The right care in the right place at the right time is not just better, it's more affordable. In closing, this work is not easy. It requires collaboration, discipline, and tough decisions. But Vermont has a long history of tackling hard problems directly and doing so with people at the center. We're not just managing today's costs, we're building a healthcare system Vermonters can afford tomorrow. I want to thank you for being here, and now I'm going to turn it over to Chair Foster from the Green Mountain Care Board.
Good afternoon. My name is Owen Foster, and I'm the chair of the Green Mountain Care Board. As the state's healthcare regulator, the Green Mountain Care Board works with our partners at AHS, DFR, the Governor's Office, and with regulated entities to tackle some of the problems we face in healthcare in Vermont. Together, we are all working hand in glove to deal with the healthcare costs associated with rural healthcare in America. Across the country, we are seeing hospital closures and service line disruptions and exploding healthcare costs. In the past 4 years, Vermont has taken important steps towards addressing these issues, and significant progress has been made. The Green Mountain Care Board has tamped down Vermont's high healthcare costs by 1, carefully addressing excessive hospital-based charges. 2, reducing waste in our healthcare system, including removing unnecessary administrative spending. We have also decreased the expenses associated with an accountable care organization, and we have redirected significant financial investments into primary care and mental health care services. These steps have resulted in Vermont having some of the lowest Affordable Care Act insurance premium increases for 2026 in the entire country. In fact, Vermont's ACA premium increases were the second lowest in the nation last year. We've done this while at the same time not losing a single hospital to closure, and our Vermont-based insurance company has begun to see a turnaround in its reserves and financial stability. To be sure, much work remains in our healthcare system is very fragile. Reducing spending at hospitals and insurance companies alone is not a solution. We need system-wide change to increase preventative care and access to non-hospital providers. Fortunately, the necessary foundations have been laid to execute on that needed change, and I will walk through some of those steps the state has taken. In 2022, the legislature passed and the governor signed Act 167, which called for a system-wide analysis of our healthcare system and identified a number of potential options and steps local hospitals and communities could take to create better sustainability, solvency, and access. And last year, the Vermont legislature and governor passed bold and innovative laws that, together with the other work described today, laid the necessary groundwork to implement the system-wide change that Secretary Samuelson's been discussing. I want to highlight some of those bills that were passed last year because they were truly monumental. First, Act 55, which reduced the prices Vermonters pay for drugs administered at Vermont hospitals. Vermont now has the most affordable hospital-administered drugs in the country. We should be immensely proud of that bold step. Act 49, which provided for important solvency protections for domestic insurance companies. This provided a backstop to make sure that Blue Cross's solvency wasn't in jeopardy. And Act 68, which created a framework to implement reference-based pricing for hospitals that will, over time, improve pricing at Vermont hospitals. At the same time, Act 68 supports community providers and recognizes the critical role that preventative care plays in creating a sustainable and affordable system. I want to note that healthcare providers across the state are also working together in new ways, trying to lower the costs for their communities. Hospitals are working together to reduce their supply costs. Hospitals are also sharing providers and identifying additional expense reduction opportunities. And community providers are working to expand access and hours and to take more patients out of the expensive hospital-based system. The legislature is also looking at new bills this session, including a bill providing for additional governance and oversight and transparency on our local non-hospital boards and domestic insurance company. Taken together, Vermont has made real progress and is in a unique position with the work done to date to transform our system. Continued teamwork and partnership will be necessary to deal with the ever-changing federal landscape, to make the hard but necessary choices, and to ensure that Vermonters have a health system that works for them. I'll turn to Commissioner Sampson to provide his thoughts and perspectives on the insurance market. Thank you.
Thank you, Chair Foster, Secretary Samuelson, and thank you, Governor, for highlighting this issue here today. Insurance, of course, health insurance is how we all experience what is a very high-cost environment in Vermont. Whether you're a business or an individual, it's that premium invoice or going onto the exchange and looking at your options that really provides a wake-up call as to some of the issues of affordability we're having. My job as Commissioner of DFR is to regulate the insurance markets and our domestic insurers, but also our licensed insurers that participate in this market. And just this morning, we launched testimony in House Healthcare on 585, House Bill 585, which has approximately 10 different distinct pieces to it, but essentially broken up into three categories that mirror the three categories I believe the Governor opened us up with, which is cost containment, also known as efficient service delivery, governance changes with our domestic health insurers, and choices or options for Vermonters. We spent hours this morning mostly focused on one of those 10, so I will spare you all a deep dive into all of them. I will try to go over them briefly again, and then I will return to House Healthcare and continue testifying on it. Choices for Vermonters, very briefly, again, I will try. We have we're one of two states that does not allow any type of age consideration in an individual's health insurance premium. That has become increasingly unsustainable in a state that borders New Hampshire, Massachusetts, where that is allowed, and it is allowed by the ACA and is present in 48 other states. What this does and what we seek to make progress in mitigating is it puts a lot of this excessive cost of care and affordability challenges we're having, it focuses on a population we're trying to attract and retain in this state, which is younger Vermonters that have very clear data to show that they have lower claims volume. We're also proposing greater access to association health plans and also opening the door in a careful way to some short-term limited duration plans, which are really an opportunity of last resort for folks, and we know there are thousands of them due to the expiration of the enhanced premium tax credits that simply cannot afford insurance anymore. So they have no coverage whatsoever. It's important that they have some stopgap options. In terms of cost containment, Secretary Samuelson referenced this in terms of site of care. We have a healthcare system that is dominated by large hospital and hospital networks. What a site-neutral billing proposal would do, which is in 585, is ensure that services like labs and imaging that can safely and appropriately be delivered in an office setting, and in fact are delivered frequently in an office setting, are not charged at a hospital rate. And those hospital rates can be as much as 2, 5, or I've seen even 10 times what the office visit rate is. So site-neutral billing takes away some of the perverse incentives and cost drivers in that area. 585 also has several provisions in there to empower insurers to do claims edits and review claims. That was a reaction kind of going halfway back to a bill that passed a year or 2 years ago, I believe, that curtailed some of their ability to do what we really need insurers to be able to do, which is take a fine eye to claims and avoid unnecessary or overcharged or even billing errors, and because we all pay for that ultimately. And then finally, insurer accountability. For a domestic nonprofit health insurer, we need them on board, fully aligned with how we execute on the things that Secretary Samuelson and Chair Foster talked about. There's very difficult choices ahead, and it's a very challenging environment in Vermont to bring affordability back into line. Our insurers have been partners for sure. What we're proposing is that for a nonprofit domestic health insurer whose board is essentially a self-perpetuating board, that we put 2 governor appointees onto that board to better reflect and communicate and energize the governance of that entity to be fully in line and cooperating with the health transformation efforts that you've heard about here today. Finally, I just want to say that none of these changes are easy to swallow. I find myself in a situation, and I believe everyone who's spoken today can acknowledge that there aren't a lot of win-win situations left. We're trying to find them and execute on them. But what really drove us to put together some of these proposals was an understanding that if we don't make some changes and rethink certain things, we are doomed to repeat or even continue the trajectory we are on. And clearly that trajectory is not working for a lot of Vermonters and Vermont businesses. So with that, I'll turn it back to the governor.
Thank you very much, Kai. And we'll open up to questions now, maybe on topic first.
I'd like to ask about our community rating, right? The fact that you can't charge more based on someone's age. Obviously, that would probably save someone like me a ton of money. But we are an aging state, right? And so how would this actually improve affordability, particularly for our fastest growing demographic, which is older people?
Well, I think we're pricing ourselves out of the market completely. There are many of our youth who don't have any insurance at all. Having some competition, having some plans that were more affordable to bring them into the market, I think would be helpful overall. I don't think this necessarily means the aging population would be paying more. It would mean that there would be opportunities for those in younger to engage in the system. So I think we have to look at it differently. We see other states that have the same demographics as we do, whether it's New Hampshire or Maine, we're 1, 2, and 3. And they seem to make it work. And we should learn from them because they have options available that would be beneficial to Vermont. But I'll let others answer as well.
Yeah, thank you. So the trajectory now is that everyone's rates are going up. And as Chair Foster alluded to, we've succeeded in a slower rate of growth more recently. But again, the trends overall are not in our favor. Of course, what we're seeing with the expiring of the enhanced premium tax credits is more Vermonters opting out of insurance. And those Vermonters, unfortunately, are going to be the younger, healthier ones who aren't seeing the value. And then the demographic shift has been mentioned. That is problematic. It focuses more and more cost in a community-rated environment on a smaller and smaller population that, again, across the border in New Hampshire, whether it's a small group exchange product or a business or an individual, we aren't doing a great job in that population attracting and retaining. So, but I think more direct to your question, if we can keep those people on the exchange, the healthier folks in the risk pool, we can mitigate any potential increases that would happen. I also should add that the age rating proposal we have is extremely modest, no greater than 5%, whereas the ACA allows essentially 300%, 3 to 1. So we're talking about 1.05 to 1. So it's designed not to create any rate shock, and again, hopefully attract and retain healthier lives into the risk pool so that everybody wins.
With less people going on insurance, certain services definitely cost a lot more. Taking an MRI, for example, are there any efforts in particular to address certain services, the pricing of certain services?
Is that something you want to tackle, Owen?
Thank you for the question. Yes, already the Green Mountain Care Board is addressing price of services through our regulatory efforts. If you look at some of the budget decisions that we've made in the last couple of years, one of our higher price systems is the UVM Health, and we have reduced their prices across the board. I think this year it was around a -8 or 9% price reduction. And as I mentioned last year, one of the pieces of legislation calls for reference-based pricing, which will have a target based on a multiple of Medicare, which over time will reduce the prices at Vermont hospitals. Thank you.
Governor mentioned the Health Transformation Fund, mobile clinics. Will there be dental clinics mobile dental clinics, do you know? And is that something maybe already going on?
Yeah, I'm not sure about that, but this is the Rural Healthcare Initiative, and we want to get out into the rural areas, but I'm not sure that it includes dental.
It can include dental practices. So when we applied for the grant, one of the things that we identified was the need to take care to where people are. We left it open to work with our healthcare providers in Vermont to determine what that care can and should be based on the needs of Vermonters. It can be substance use, it can be primary care, it can be dental, but we don't want to get ahead of ourselves. We need to work with our providers in the state to determine what the best options are for that and where. We have seen that dental care through mobile units has been very successful. Several of our FQHCs currently do it, although some of them are struggling to continue given the workforce shortages to keep it going.
$1 billion over the next 5 years, that's a lot of money. We haven't seen that much since like COVID, right? You know, what is being done right now? And it's coming out as fast, as you mentioned, it's happening now. What planning is being done to, number one, make sure that this money isn't going to one-time initiatives like we saw during COVID, and number two, that it's going to initiatives that we won't have to give it back to the federal government? Because I understand there's like good costs with that.
I can start. We have to reform to get all of the money, the $1 billion you talked about. What's probably not at risk is the first $500 million. But we have to make sure that we're following through on what we say we're going to do. There's, I guess, in place, there are steps that the feds will take to make sure we're doing as we said. So without that, and that's a good incentive for us because we want to make sure that we continue to evolve and make sure this program works for Vermont, and then we get the rest of the $500 million.
Yeah. To go back to the last question, this is a cooperative agreement. It's different than many of the other agreements. It's a relationship back and forth with the federal government. So we've put in an application including many of the things that I talked about. And the reason I can't commit to dental is that we need to work with the federal government to approve that. It's their way to have accountability in the state. That said, when we put in our rural health transformation application, one of the things that we did is we didn't start over. There was a basis of work that Vermonters and Vermont providers, the state, the legislature had already done through Act 167 and other reports. There's work, things that we had piloted, like mental health urgent care, or some of our workforce programs that we can bring to scale with these resources. So our goal was to make sure to invest in things that we had already decided were important to implement for Vermont, in which we already had a foundation to implement. Things like the Maple Mountain residency program, where there's a medical residency in FQHCs. This funding gives us a chance to invest in the things that Vermonters have already identified as for healthcare reform. It's a once-in-a-lifetime opportunity for us to move those things forward, but it is one-time funds, and we need to be very cautious about those investments.
And the JFO, there's been numbers batted around, but the JFO yesterday said that by FY 2032, as of HR 1, we could lose out on $144 billion, I think, in Medicaid funds, which also has ripples through the system. Just in terms of money flowing in through our system, how will the Rural Health Transformation Fund, interplay with some of the Medicaid cuts that we're seeing? Like, where, are we going to see net loss, net gain?
Yeah. I don't want to take and make estimates on what's going to happen with HR 1 because we don't know yet what the enrollment and the re-enrollment and the work requirements or community engagement requirements are going to have. So I'm not going to go there. But what I can say is that when we look at the rural health transformation funding, it allows us to address the root causes of the costs in our healthcare system. So we've all been talking about increases in premiums, increases in utilization in the Medicaid program. Our goal is the programs that we are investing in the rural health transformation program will fundamentally address those root causes to help stem off those increases. And so while we can't estimate right now the offsets between those two elements, the decision around the subsidies is a federal decision, the decision around the program changes are federal decisions. What we can say is that we're really hopeful that the Rural Health Transformation Funds will fundamentally change the trajectory of healthcare in Vermont.
I should also add that this was somewhat of a negotiation with the administration, Dr. Oz in particular, and from the outside looking in, from our interaction with them, they could have taken our first application and then just said, we're not doing half of this, and rejecting it. But they worked with us. It was very interactive, told us the areas that they couldn't support, and gave us an opportunity to rectify that and to negotiate this. So, you know, as we're calling balls and strikes with the administration, this is one area that I thought we really did have a seat at the table, and we were working hand in hand because they wanted to work as well.
We have one more question on topic online. Tim from office.
I have a couple of questions, Amanda. Actually, just quickly following up on Lola's initial question. The age rating issue, does that have to go through the legislature to get approved? How's that going to work?
I would imagine so, but
It's kind of nuanced. The Commissioner of DFR has the authority to publish regulation that allows up to a 20% deviation in community rating factors, which are many, but age is one of them. It's a significant enough shift of how we do things in Vermont, even at just 5%, that we prefer to talk to the legislature about this and get their explicit endorsement or approval, as it were.
Okay, and for Chairman Foster, on the reference-based pricing, does this include the private providers who are doing MRIs and endoscopy and that sort of thing?
It does not. The reference-based pricing system will be implemented through the Care Board's regulation as to hospitals. However, there is a component of the legislation passed last year where the Care Board is going to look at the prices paid for non-hospital providers, really more in an effort to get the prices more equalized and up. And I believe it also relates to the bill that Commissioner Sampson mentioned, 585, which has the concept of site-neutral payment in it.
And one thing, and also, if I may, as far as the private providers, they're sort of taking the low-hanging fruit from the hospitals. You know, this is the easy stuff, sort of, it's, you know, the birthing centers have had such trouble because the overhead is so high and the reimbursements are so low. Is there a plan to move forward that the hospitals aren't being cannibalized on the high margin stuff like that?
I'm not sure exactly how you're using the word cannibalize there. You mean to refer to the hospitals maintaining all of that, or cannibalizing in that they're losing it?
They're losing these profit areas.
Yeah, we want them to compete on price. We don't want to see hospitals with MRI prices that are 10 times the price of that service somewhere else. So we hope that they can keep it, but we hope that they can keep it at an affordable price for Vermonters, and if they can't, they should lose the business.
Well, as you know, they're using that money to pay for ER losses and that sort of thing. And I'm sure you debated this with them quite a bit. I'm just wondering as this moves forward, what the response is going to be.
There will definitely need to be system-wide change. I mean, the way we finance our hospital system now for years has not been sustainable, and part of it has been sustained with very, very high prices that we have to address because of what we're seeing on the decrease in reserves at the insurance company and our extremely high premiums for Vermonters and our small businesses. So we're hoping, and we have seen hospitals respond with greater efforts at efficiency and productivity and cutting unnecessary spending. So there's a layer there that we'd like to make sure that we capture by reducing prices. And then also, yes, we do believe that the system will need to change because there is not enough money for Vermonters to pay to sustain the status quo. I think that relates to how Secretary Samuelson described using the Rural Health Fund to try and really ensure that we don't lose important access and we have more preventative care.
While you're up
All
there,
right, thank you.
do you mind if I ask you about age rating?
Yes,
Do you support the administration's proposal?
I do. The age rating that's proposed by the administration is rather modest. And I think to your question, which I thought was answered well, Costs go up when you don't have those healthy lives in the pool. When you don't have the healthy young lives, the costs go up. So it's really a balanced measure to try and make sure that the pool stays younger and healthier. A lot of the insurance rates the Care Board's been receiving the last couple of years, one of the most significant drivers is the illness of that pool of patients. So by increasing the health of that pool, we should see lowering insurance premiums.
Thank you.
Governor, you released a statement on Sunday following the shooting of a second protester in Minnesota. I'm wondering if you can describe your thoughts as you saw videos coming out of the state and what you think next steps should be.
Yeah. Well, I think the statement that I put out pretty much sums up what I think should happen. Obviously, a tragic incident that was avoidable. And that was problematic from my standpoint. It did appear, we saw the video footage from many, many different angles. And every single time I watched it, I got to the same conclusion, that it was just an error in training, that I think things got out of hand, and it certainly should have resulted in someone staying alive rather than somebody dying as a result. So I do think a pause was necessary to reflect on a number of different things, to tone it down, take the temperature down, and work with the community rather than using some of the paramilitary actions that it appears that they're utilizing in their approach over the last few weeks in Minneapolis in particular.
Are you satisfied with the response of the Trump administration so far, or do you think that they should take additional measures?
Well, I'm hoping that they're going to take additional measures. Well, again, they've taken a pause, they've restructured, they've taken somebody out of power. Those are steps in the right direction, but it's only been, what, 3 days? We'll see what happens next. I just want to make sure, from my standpoint, that they follow through and that there's an investigation that gets to the truth, and that all parties would be a part of.
A number of members of Congress have said that the Secretary of Homeland Security should be impeached or fired. That Stephen Miller should go. Do you agree with that? Disagree?
Here's what I know. I know there's one person at the top of the heap who can tell his secretaries, commissioners, directors what to do. And it's within his power to de-escalate this. So I'm more interested in seeing a different approach than I am about whether somebody's impeached or not. I think that's just some drama. And I think that regardless, I mean, maybe they should, maybe they shouldn't, but we shouldn't take our eyes off from what needs to be done. And that is a different strategy for accomplishing what I thought they were setting out to do, was to deport the worst of the worst, those who are criminal, those who are violent, and I think many, many Americans could get behind that. But at this point in time, it looked like a roundup to me.
Some of Vermont's members of Congress have said that they will vote against the appropriations package later this week that includes funding for DHS. Do you support that? Would you urge Vermont's members of Congress to vote for or against that package?
Well, again, I think you have to utilize some of the tools you have, and I'm not sure what tools the Congress has other than investigating, but also funding. So they have the power of the purse. So I would say that it gives them an opportunity to negotiate what happens next.
Does that mean you also would oppose that funding package?
I would hope that, again, the administration would come to the conclusion that they need to change the way they're doing business, because it isn't it certainly isn't the Vermont way, but I don't think it's the appropriate way that we should, in the United States, should be handling this type of situation. So I would give them the opportunity to do that, but I would hold my cards and make sure that they follow through on what they say they're going to do.
But the question is, it's going to be a yes or no question.
Well, when are they voting on this?
Later this week, I think, Friday.
Okay, well, again, I think a lot can happen between now and then, and I would want them to make sure that they were getting what we all want, which is a different approach. And if I'll go out on the limb here, if they don't support that, and they're not going to change their ways, then I would vote against it.
And in the legislature, as you know, the Senate is weighing at least two measures that would rein in ICE and other federal officials in the state, S-208 and S-209, which, as you know, would limit federal or all law enforcement officers from wearing masks, require them to identify themselves, and the second bill would restrict locations of civil immigration arrests. What's your view on those two bills?
Well, again, I don't know all the details of the bills, so much like here. I'd have to see exactly what they do, but in terms of masks, I've been pretty clear on the masks from the very beginning. I put out statements on that, I believe. You have all asked me about this, and I'm opposed to masks for law enforcement entities. I think you should be visible.
So you generally speak, not to see the details, but you'd be inclined to sign S-208 into law, then?
Well, again, it depends on the details because they do matter. But in terms of if it was just about masks, then I would support that.
And what about the second? Sorry, just last thing, that second bill, S-209, about restricting where civil arrests can occur?
Again, I don't know. I would have to look at that one further. I just don't know.
When you talk about ICE and Border Patrol agents changing their approach, are there specific changes to their operational policies that you would need to see, or are there specific reforms that need to be done?
I believe there's a significant amount of training that needs to happen. I can't imagine sworn officers, and remember, these are immigration folks. They've expanded their team over the last few months, and I don't think they've had the proper training to deal with the general public. So I would say that they need to take a pause on this and get the training they need, or take a different approach altogether. There's a better way to do it.
Like as tensions continue to rise in Minneapolis, and I don't know, like immigration is really under the public spectacle right now. Two of your two nominees for the state Supreme Court, Drescher and Nolan, have both been under heat for prosecuting the Trump administration's agenda in Vermont. I'm wondering how you're feeling about your appointment of both of them, if you still stand by your appointments.
Well, I think they stood for the rule of law, and I commend them. I interviewed both of those candidates, and I think they are exactly what we need on the Supreme Court. They were just doing what they thought was right in supporting the rule of law in this country. So I think they've done a really good job in their testimony in the judiciary, and having, for instance, having the attorney for Mandawi there to support the nomination. I think that's pretty powerful when you think about that somebody that was defending Mr. Mandawi is saying that one in particular is Mike Drescher was a consistent and clear voice of reason, and so I think that speaks volumes.
And do you, I mean, whether he did that, like whether he believes in the rule of law or not, in court he basically argued to, like, in favor of the detention of Mandawi. And I'm wondering, I don't know, what do you have to say to Vermonters who still can't parse that, who are still really struggling with that? Even if he was just doing his job, he in practice was enforcing Trump's agenda. Yeah,
well, again, some of the things that we talked about this a lot during the interview. He was as much protecting his staff as anyone else. I think that's admirable. That he could have easily pushed this off onto a staff member and let them deal with this. But he took it upon himself because he thought he should take the brunt of this and not leave it to them. So again, character means a lot to me, and I think he has an incredible amount of character.
Governor,
before I understand correctly, DOC does now release, Vermont DOC releases ICE detainees to ICE? I think I heard you say that last year, that if someone is in DOC now, and ICE says, we've got a detainer here, and then you release them.
Yeah, they're,
Now, and I understand in Minnesota, they don't. Would you recommend to governor say, hey, we think this would be a good idea?
I think the governor and the administration, the governor and president need to talk about this and taking whatever approach they deem necessary to tone this down.
Governor, last night the Windsor County Sheriff was arrested on charges related to sexual misconduct. Are you calling for his resignation as sheriff?
Again, I haven't, I knew that there was something afoot there, but I didn't know about all of the details. So as we look into the details and the strength of the case, I would be happy to make a comment after investigating that myself. But it would be hard for me to believe, under the current circumstances, that he could do his job.
Governor, back to the issue of ICE. What is your administration doing, if anything, to prevent the type of escalation of ICE enforcement in Vermont that has happened in Minneapolis? Bearing in mind, I know that it might be very difficult to accomplish, but what are you trying to do?
Yeah, I think, again, we've had a number of different protests over the last year, and I'm very proud of Vermonters for the way they did it and accomplished that. Passionate, yet I think that they were respectful. And so if we can continue to do what we're doing, what we've done over the last year, I don't think there will be a problem. But suffice to say, we're working with our public safety folks to make sure that we have a plan in place when and if, and we'll do it the Vermont way and make sure that we protect the First Amendment right of those who are protesting, but also making sure that everyone is safe in this environment. So it's not lost on us that this could happen here, but from what I want to reiterate, if we continue to do it the way we've done it over the last year, there won't be a problem.
Are you suggesting that the enforcement actions of ICE in other places have been in response to protests that have gotten out of hand?
No, I'm saying that their approach there was different, and I think there was a lot. There were a number of folks that were antagonizing both sides in some of the, from what I saw in video, but we haven't done that here, and so we would, we've reached out to the federal government. I'm not sure that they're going to be here in Vermont, but we want to make sure that we have a way to interact with them to set what we think are the standards.
Okay. And the last question would be, what did you mean in your statement when you said that if the Trump administration didn't de-escalate, that Congress or the courts should restore constitutionality? What was the unconstitutional conduct?
Well, they have the power, again, they're under their jurisdiction is things like the power of the purse. So they should make sure that they're doing that to prevent anything from happening further. But again, let's hope it doesn't get to that point. But they have broad powers in egregious situations.
So just to clarify, does that mean you're saying that Congress should not increase funding for ICE in the upcoming federal fiscal year?
I'm saying that they should reflect on what the need is and what the strategy is going to be in the coming future. What are they going to do with the money? And if that doesn't pass muster with Congress, then they should change their approach. They maybe insert. I mean, it happens all the time in our operations here that language is inserted to be sure that the money is used for the right purpose.
Governor, you threw your support behind Senator Baruch's cost containment legislation for FY27 and FY28 for education. Do you have any other potential vehicles that would contain costs?
You mean immediate?
Yes.
Yeah.
Not for 27, not for the current year, but the next couple of years.
Well, I think everything that we're putting through with our plan would get us to a point. Obviously, we know that there's going to need a bridge over the next year or so, even if we pass everything today and implement a smaller number of districts. We'll still need to backfill in some way in the coming year. So we'll be building our budget according to that in the future. But as well, I think school boards and the voters need to do their job and contain the costs as best possible.
In 2024, you allowed an ethics bill to go into law without your signature. You said concept is great, uniform code of ethics at the municipal level will build trust in government, but you said it was an unfunded mandate, so you were reluctant about it. Your position has since been vindicated by the Ethics Commission and lawmakers, by all accounts. There isn't enough capacity at the commission to fulfill these new duties. You submitted a budget this year that does not contain additional funding for the Ethics Commission to carry out its statutory duties. And I'm wondering why, given your belief in the promise of this work, your budget didn't reflect the financial needs of the commission to undertake it.
Yeah, well, again, we had to make difficult choices in this budgetary cycle, knowing the limited amount of resources that we have. And we try to prioritize areas that we think we're in greatest need. I think property tax relief is one of them. And so it's give and take here. And so we'll see what the legislature decides, but I think tax relief is one of our highest priorities.
What's the point of that law that you allowed to go into effect without your signature if
Well,
it doesn't have the money?
I still think that they can perform their function, maybe at not the scale that they'd hoped, but they can still perform their function.
Have you been briefed on what's happening in global boundaries?
No.
Governor, what do you think about the Trump administration is threatening to increase tariffs on Canada? Do you have any thoughts on that?
Well, I think my thoughts on tariffs are well documented. I think it's a bad idea. And I think that, in particular, working against our friends to the north puts us at a disadvantage. So, again, it may be just the threats. It's just, I think, it just makes no sense to me at this point in time when we have other countries that we should be at odds with, mainly Russia, China, and others, but Canada isn't one of them. So we need to mend that fence.
And just one more, there's a Senate bill that would change the requirements for car inspections from 1 year to 2 years. Do you have any particular views on that change at all?
Yeah, I'm not opposed. We were putting forth some changes to our inspection law to take out the real areas that were just inconvenience rather than safety measures. So I'm all ears at this point. I think the question is whether we'll be afoul of the federal law in terms of the emissions standards, whether we can do it every other year or not, or whether we still would have to do that every year, which would not make any sense in terms of the inspection process itself. So there are details there that we'll take a look at, but I'm not necessarily opposed to it.
A question on H601, the Clean Energy Standard Bill. Can you say more about how, if that passes, how you would want to see nuclear energy expand and what kind of details what that roadmap would look like for you?
First of all, we just want to take credit for carbonless energy. So we would want to make sure that we were, like other states have done, taking credit for that. But I think, that's the technology is there. I think it's going to be a source. I think you'll find many environmentalists, and they're on both sides of this, but understand that having a carbonless energy source like nuclear could be the only way we find our way out of this. So if we truly want to reduce our reliance on fossil fuels, I think nuclear has to be in the mix, but it's years off.
Two environmental groups on that exact bill raised some concerns about importing nuclear waste from other states
Yeah.
into Vermont. That was in that bill that you said you supported. Do you support that provision?
I have, that the bill requires?
No, allows. That allows, I think,
Yeah.
the bill had a provision.
Have Commissioner Johnson,
importation.
Commissioner Johnson's on now. Maybe you can answer that.
Thank you for raising that question. What I would say is, no, that was never the intent. And if you take that one provision, absent the rest of the other provisions and out of context, and you look at it just right, you could interpret it that way. So we've already changed the 3 or 4 words that we need to change, so nobody could have that interpretation. That was never the intent, and that was never part of our vision. So thank you for giving me the opportunity to set the record straight, as we have already done with legislators. Thanks.
As he says.
Commissioner Johnson, one other feature of that bill is that it eliminates the current public consultation process before the construction of a new nuclear plant and removes legislative oversight approval of a new nuclear generating station. Those provisions would concern some people as well. Why should Vermont not have those protections against a new plant? Oh.
Carrie, you're on mute.
What we're trying to do is to put nuclear energy consideration on par with other sources. For any nuclear power plant to get permission, to secure permission to be able to operate in the state of Vermont, 1, you'd have to have permission from the NRC. 2, there's a long, involved, and multi-party process with the regional grid operator, Independent System Operator New England, or ISO New England. There's a whole regulatory process there. Thirdly, it would have to be approved by the Public Utility Commission with advocacy by the Public Service Department, representing ratepayers, my department, and that is a process that would take considerable public input, the opportunity for stakeholders to engage there. So there's at least 3, let alone the Regional Planning Commission, how that fits within this Section 248 process. There are no shortages of opportunities for regulatory review. There are no shortages for the opportunity for public input. What we're trying to do is at least create a path so it is possible. Not that it is a slam dunk by any means, but simply eliminating what we see as some of the redundant reviews, and in fact those things that pretty clearly were meant to thwart the ability to use nuclear energy. And as the governor said, if you're serious about reducing fossil fuels and emissions, we need to be a bit more creative and open-minded about what resources are possible at scale.
Governor. Oh, sorry.
I've been wondering, in your budget proposal, you proposed spending $200,000 to increase the pretrial supervision program statewide. Less than 20 people in the state have ever taken part in the pilot program. 1 person in the state is involved in the program now. Why are you so invested in expanding it, and why do you think it's a program worth spending $200,000 on?
Jay, you want to explain in legal terms?
Sure. Thank you for the question. I'm actually testifying tomorrow in House Corrections and Institutions on this issue. So our proposal is based on the fact that the state has seen, over the last decade or so, what many people refer to as catch and release, or the revolving door of the justice system. We know, and we have sought to address, the cases of 5 or more people in the system, 5 or more offenses by the same individual in our criminal justice system. When we've been proposing our packages of criminal sort of procedural and law reforms over about the last 5 years, much of the effort was oriented toward reducing this catch and release, or addressing the catch and release issues. So when I was testifying in Senate Judiciary, probably about 3-4 years ago, Senator Sears, who was seeking to keep people out of prison, but also seeking to address the catch and release system, or not system, it's not systematized, but it's the impact, came up with this idea of a pre-trial supervision system in Vermont, like the federal system. In that way, a person is supervised in the community. They can perhaps remain connected with the services of their conditions of release. They can get reminders to show up in court for their proceedings. And all in all, conceptually, it's a great idea. But in practice, and in the way some of the language works, it actually inhibits the working of the system. So we've not only proposed additional money, we've proposed statutory changes to go along with that. Part of this is, the defense bar routinely objects to pretrial supervision because they feel that there are Fifth Amendment consequences as a result of some of the information that needs to be disclosed, including a risk assessment that needs to be done. So we think there are improvements to the process as well as the funding. We think it's a good idea and worth pursuing. It does allow individuals to remain in the community pre-trial rather than being held on bail in a DOC facility. So it's something that we're continuing to pursue.
I just have one last one. The Morrisville Select Board is, might have seen in the news, they're considering relinquishing 18 or 19 rural roads, long roads. They cost a lot to plow and maintain, 1 or 2 houses on them. It's in an effort to try to save money in the local road budget. As you know, we've had massive transportation fund issues from the state. I know we're leaving a lot of federal money on the table too. It's all interlinked. Can you just maybe, can maybe you or Secretary Flynn talk about, like, do you expect to see more, towns give up ownership of roads?
Yeah, I'm not sure about that. I just want to, we are not leaving any federal money on the table. We are matching the federal money in a manner that may slow it down a little bit, but we're not leaving money on the table from a federal perspective.
The League of Cities and Towns says we've left $200 million over the last 5 years.
Not that I'm aware of. We have, Secretary Flynn.
Thank you, Governor. What was your point about cities and towns, Calvin?
They had a statistic last week in one of the committees that there's $200 million of federal money that's been left on the table that we haven't been able to draw down.
No, I'm unaware of that. The reference might have been that in the last 5 years, $220 million has moved from the purchase and use tax account to the Ed Fund account that would have otherwise gone to AOT or VTrans and would have been able to be used for additional work with sort of the global bucket of federal money. We are not leaving $200 million on the table. That's an inaccurate thought. It may have been inadvertently stated because I don't know where they would have got that.
I will double check.
I haven't heard about any roads to the extent you're referring to in Morristown, but I'm not saying that that's not the case. I'm not aware of that. I think you also said because of the declining budget that we put forth for towns, I don't want to misspeak. Is that what?
Yeah, basically they're saying because of budgetary issues.
Right.
And
sure.
The declining gas tax, et cetera,
Sure.
et cetera.
So, I mean, we've all talked about the pressures with sustainable transportation funding long-term. But that's exactly why we've proposed what we've proposed in the governor's as recommended budget over 5 years to wean back or wean off using purchase and use transportation tax dollars to fund education, which is why that's a very important initiative as well. They're more interconnected than people might want to think they are. But, it's a situation where we are maximizing what we have to work with today. I mean, we have provided a balanced budget. In fiscal 25, or I'm sorry, in fiscal 26, we had $100 million for Vermont towns. We're proposing $97 million. There's a requirement by law of the minimum we must put forward for towns. What's not being picked up is we're meeting that requirement. We didn't add to it because we had a lot of pressures this year. It's out in public. I had to present a budget last week that eliminates 31 positions. That's part of the justification for why we had to make some tough choices. I've also stated in testimony that every one of us live in a town, every single one of us. Every single one of us vote at the local level. We are all aware of our issues. In my town, I was on the select board. I know. But we have just so much money to work with. And if the legislature or anyone else wants to change the size of one wedge in the pie, they have to tell us what other wedges do they want to decrease. So I am not trying to be flippant toward the concerns the towns have, but the simple mathematic reality is that short of increasing the cost burden on Vermonters through taxes, we have to make the kinds of choices we make. None of that intends to mean that towns aren't in a tough spot. Towns are facing the same 40 to 60% increase in construction that the agency faces. I'm sure towns face the same labor pressures at times that we face. We heard a lot about healthcare this morning. All of that is real. Nothing in what I say fails to realize that. But everything I say is that we come into the session, unlike many agencies and departments of government. We have a finite budget that's funded. Most other agencies and departments come in, basically, here's what we want to do, here's our budget. Will you agree to giving us the money? Ours is laid forth because all of the state match comes from the DMV across the street, and the rest comes in predictable, guaranteed federal funding. But it only accounts for so much. But 200 million of it are not left unused. All right, thank you.
I'll take some from.
Yeah, we have time for one more.
Yeah, just feel bad for the folks online.
Oh, yeah, sorry, I totally forgot about that. We're out of practice. Keith Whitcomb, Rutland Herald.
Somebody already got to mine, so thank you. Appreciate it.
Thank you. Tom Davis, Compass Vermont.
Thank you, Ashley. Governor, real quickly, Senator Welch joined with Senator Cruz to make some changes to allow more competition from satellite providers of high-speed internet. In the process, it sort of shined a spotlight on the Vermont Fiber's position of fiber first at all times. And with the question of the BEAD funding, have you or anybody in your administration had any conversations about them maybe changing their perspective on adding in more satellite services, how we provide these people in rural areas who are waiting years to actually have internet?
Yeah, I do think satellite could be part of the mix, but we want to make sure that there's a trunk of fiber there as well. I think that's important, especially up in some of the rural parts of our state. But to fill in all the gaps, I think satellite, as it improves, I think could be helpful. But I will say that it's not adaptable to some of the areas of Vermont that we have. It's so mountainous, tree covered, and so forth. Sometimes the satellite just doesn't work. So again, it's just having that available, I think, is important. But we want to make sure that there's fiber in place that will meet our expectations in the future.
Okay, thank you. No other questions.
Tim, Vermont Biz.
Well, I don't have anything else. Thank you, Amanda.
Thank you.
All right. Thank you all for coming. Appreciate it.